Thanks. Welcome, everyone. Today is our Pennsylvania's Early Childhood Health and Safety System Supports webinar. Today's webinar is entitled Supporting the Social Emotional Well-Being of Early Childhood Education Professionals, Children, and Families. This is the 5th webinar in the series of 5. Today's topic, Supporting the Social Emotional Well-Being of ECE Professionals, Children, and Families. We welcome you. Today's live webinar will be followed tomorrow by a 90-minute open space session for questions, reflections, and sharing. And of course, we welcome all questions. You may submit them anytime to hssco@pakeys.org. Just some housekeeping. Today's live webinar is in presentation only format, so all participants are muted. Please turn off your video. You may type questions anytime into the chat box during the presentation. We will be monitoring the chat box and we'll do our best to respond if the time permits. And tomorrow, of course, we have the follow-up session where we review a lot of the questions that come into the chat box. So if we don't get it answered today, we will make sure to answer it tomorrow and move from there. My name is Amy Requa, and I'm the Senior Health Manager at the Pennsylvania Key in support of OCDEL. Next slide. And our co-facilitators and guest perspectives today, really honored to have Brandy Fox here to present with us. Also Laura Johns and Sue Zeiders. Thank you so much for joining us today. Our goal for today's webinar is to provide our support teams with information and resources to support the social emotional well-being of ECE professionals, children, and families. And hopefully we have a good selection of folks out there, good representation from our early childhood health and safety system support teams listed here, and that you have been attending all of our webinars and hopefully learning lots of good things and sharing and moving forward together. So we welcome you today. And I'm going to turn it over right now to our guest speaker, Brandy Fox.
Good afternoon, everyone. Thank you for joining us. We're going to talk a little bit about supporting the social emotional well-being of our early childhood professionals, children, and families. Next slide, please. But I really wanted to start with this idea of self-care isn't selfish. So in today's webinar, there'll be information and dialogue, perhaps, that might be upsetting or even overwhelming as we think about mental health and wellness, so the collective of mental health and wellness. The current landscape in combination with our personal experiences are stressful and can trigger trauma responses in many ways, and we wanted to approach this webinar series in a trauma-informed way. So please take whatever measures you need to take care of yourself, such as tuning out, leaving the room, messaging one of us privately, or any other self-care or safety strategy that might help you feel safe. When we think about self-care and we think about the idea of secondary trauma, there's a lovely quote that I found that says, you know, we are stewards not just of those who allow us into their lives, but of our own capacity to be helpful to them. So that's a big key piece of self-care and monitoring ourselves for our own mental health and wellness. Next slide. So really what we're talking about today is this idea of, you know, infant early childhood mental health and mental health. And when we think about infant early childhood mental health or social emotional development, it really is the capacity to form secure relationships, experience and regulate emotions, and explore and learn in the context of your family, community, and cultural background. It's really about how we think, feel, and behave. And it is a key piece in our overall health, physical health and mental health. And so we really wanted to try to focus, and I tend to gear toward the birth to 5 population, but we really wanted to broaden this conversation and say, you know, we're all experiencing this landscape, we all have social emotional health that we need to pay attention to. So the other co-presenters, and even in the chat box, you know, we're going to be depending on everyone collectively to make sure that we're addressing kind of birth through the entire lifespan. Next slide, please. And so really, you know, the definition of early childhood mental health or mental health really is synonymous with healthy social emotional development, and it does apply to children and adults. Next slide. And a key piece of the work that we're trying to do in the communities, and we've done this before, and it's a little amped up because of this health pandemic, is really a key responsibility we have is to understand trauma. And there are some three kind of key words that are thrown around when we're thinking about trauma. You know, we think of trauma-informed care, trauma awareness, and trauma sensitivity. So the definitions are on here, but trauma-informed is really kind of, is defined as those practices that promote an environment or a culture that has safety, empowerment, and healing. And when we think about trauma awareness, we're really thinking about, does our workforce families understand what responses to trauma are in terms of the effects, the symptoms, and the impacts? And then how do we communicate that and provide education about those type of topics within our sphere of influence? And trauma sensitive, you know, schools or workplaces are a safe and respectful environment that really enables individuals to build relationships with others, to regulate themselves, and to succeed. And this concept is really about, you know, we need to recognize that everyone we come into contact may, at some point in their life or currently be going through something that they perceive as trauma. And so that we really need to keep and hold that in mind as we're interacting with people within our scope of work or even in our community or our family. Next slide, please. So a question we have for you, and that we've kind of, a theme that I guess has come up in different webinars is, you know, should professionals, families, and children be doing something different to support the social emotional and mental well-being of those around us within our scope of work? And I'm going to venture to say, not really. I mean, yes and no. Let's just put it that way. So it's important to know that many of the things that programs and early childhood professionals have been doing prior to the pandemic are still very important. Nurturing relationships between children, family, and staff, routines, play, targeted social emotional strategies that are building the capacity of our young children to express and manage their feelings, developmentally appropriate practices. But just as important is to be cognizant that everyone has been impacted by the pandemic in different ways, including a rupture in relationships and attachment, including a drastic change in routines that everyone was used to, and new routines that have been added on. This can result in kind of trauma responses in a myriad of ways. Next slide, please. So we really kind of want to bring everyone down to think about focusing on those foundational practices that we know are really, really good for children, and they're good for adults as well. Next slide. So I just want to reorient us to the pyramid model. The pyramid model is something that Octal has supported for many, many years now. And it tends to be the foundation of much of the work that our early childhood professionals are doing, you know, across the state. And the pyramid model is a conceptual framework of evidence-based practices for promoting healthy social emotional development. As you'll see at the bottom, it's supported by an effective workforce. The foundation for all of the practices in the pyramid model are the systems and policies necessary to ensure that workforce is able to adopt and sustain those practices. When you go to the blue section, you're looking at universal supports that are appropriate for all children through nurturing and responsive relationships in high quality environments. These include the practices needed to ensure promotion of social development for all children. That next level is really about prevention. It's representing practices that are targeted social emotional strategies that prevent problems. And the top of the pyramid really is geared toward few individuals And that's intervention, which is comprised of practices related to individualized and intensive interventions that are really working to address kind of some really challenging struggles that a child or an adult may be having. And what we know about the research on the pyramid model is that it shows that children have better social skills and less problem behavior, and teachers are able to implement those practices better if they receive high quality training and coaching and professional development around these practices. And the next slide. So the next couple slides are just focused on some of the key goals of the pyramid model. I'm not going to read those, but really it's meant for, the pyramid model is meant to address every need within a child in a program. And the next slide. And the big ideas are around that it's a framework that supports social emotional development. The foundation of the pyramid, which is the effective workforce, is the most important piece, and that we know that an effective workforce really can engage in relationships and developmentally appropriate practices and high quality environments that really prepare children to be ready for school and have good early childhood mental health. And the next slide, please. So when we think about, what are those key social emotional skills that both children and adults need to be successful in their community? We kind of go back to several national reports, such as the Eager to Learn, Neurons to Neighborhoods, A Good Beginning, and the Kaufman Report. And they've discussed the importance of social emotional development in children's readiness for and success in school. And so the bullets on this page are really key skills that we all need in order to be effective in our communities, in order to be confident, in order to develop those relationships and interpersonal skills, to concentrate and persist on something that's challenging, to effectively communicate our emotions, to be attentive and be able to follow through on tasks and to solve problems. If you'll think about it, this pandemic has really challenged all of us in these key social emotional skills as we are navigating kind of this new way of being, this new way of developing relationships, or this new way of doing our job. So that kind of brings me to this idea of the 4 R's. So my infant early childhood mental health consultant team created an amazing experience discussion groups titled Holding Spaces for different audiences across our early childhood system. And they were really grounded in this idea of these 4 R's, regulation, relationships, resilience, and reassurance. Because we're in this pandemic, this time of crisis, we've had a lot of stress, a lot of change, a lot of uncertainty. And during this time, we're depending on each other in very new and different ways, and we've got new routines. And so as children and adults are going back to work or doing work differently, or school looks differently, we have to think about how are adults regulating themselves so that they can help to co-regulate or regulate children? How are we going back to this idea of relationships and rebuilding relationships with, if you're a health and safety TA, you're building or rebuilding a relationship with a program, a director, a teacher. Those teachers or directors are rebuilding relationships with children and families because there could have been a rupture there in terms of routine and attendance and whatnot. So on the PAKEYS website, we do have 4 handouts related to the regulation, relationships, resilience, and reassurance that might be helpful as you are out in the field building the capacity of other practitioners in their support of families and young children and their staff. And as always, our consultant team would be available to help you think about, how you might use those resources in your work. My daughter was just talking to me, sorry about that. And so as we think about the pandemic and how it's been stressful on everyone, including our children, we need to take the time to think about stress. So there's been extensive research on the biology of stress and how that impacts healthy development and how that can derail development by excessive and prolonged activation of that stress response. So it's important to distinguish among 3 kinds of responses to stress. There's positive, response to stress, which is normal. It's an essential part of our healthy development, and it's brief, and our body kind of gets back to normal after we've kind of coped with that level of stress. There's tolerable stress, which activates that body's alert system just a little bit more, maybe as a result of a more severe or longer lasting difficulty, a natural disaster, a frightening injury. But if that activation is time limited and it's really buffered by relationships around that adult or that child, the organs, your body, your brain starts to recover from what might be a damaging effect. And then we get to the toxic stress. And the toxic stress is where there's strong, frequent, or prolonged adversity without a buffering relationship. And this type of stress can really disrupt the development of the brain. It can disrupt our ability to regulate, express our emotions, pay attention, kind of complete our day-to-day activities. And it also, the research shows that it also can impact our health, our overall health in terms of our body and our organs and illnesses and sicknesses. So it's really important to think about levels of stress, not only as you're interacting with the programs you're supporting, but also within yourself. And trying to identify if there's times where I, as an individual, need to do some self-care so that I am recognizing my level of stress and my ability to be mindful of that. Next slide, please. So as you're kind of out and about supporting your own children, people in the community or even in the programs that you're working with, we really need to keep in mind, or help others keep in mind, that there might be some noticeable changes in behaviors, emotions, and social interactions by children. These behaviors can be challenging, such as temper tantrums, hitting, or more subtle around withdrawing or seeking comfort or attention. So this bulleted list gives a sense of some of the different kind of behavioral responses families or educators might be seeing as children return and come back from the pandemic, or that they have just been there all along. But we also have to be mindful, next slide, that adults have these type of responses too. They look a little bit different. They could look the same, but a little bit different or a little bit more intense. So we may find ourselves as adults in response to stress, our eating or our sleeping habits have changed. We may be, other than kind of social distancing, we may be also significantly pulling away from people and things that we used to interact with on a more regular basis. Our energy might change. We might be hyper-reactive, right? There's a lot of stress and anxiety right now. There's so many things changing almost every day, and that creates some anxiety and some hyper-reaction. So, you know, how I might respond to my 12-year-old kind of challenging a directive pre-pandemic might be very different from my reaction in a stressful state. So just keep in mind as you're out thinking about doing this work to reflect and pay attention to what your own body is telling you, but also this information can also help you to, you know, have some reflective conversations with other adults who also might be indicating or showing some of these type of behaviors. One thing I'd like to look into as an initiative, hopefully, is just to bring more attention to mental health first aid training and how that can help us as community members and as the Octel supports in recognizing and helping to direct individuals who might be struggling to the supports that they may need. And the next slide. And so ultimately what we know is that relationships are the intervention. And we say that in infant mental health a lot, that we're looking at the relationship between the child and the caregiver. But I would expand that to say those relationships also occur between the caregiver and the family, between the staff member and the director, between the mental health system and the early childhood system. So if we think of throwing a rock in a bucket of water and you see those ringlets go out from that bucket, those you can think of is the parallel process, is that all those relationships matter to keeping that baby in mind. And so that healing comes through those repeated interactions with a compassionate and regulated other. And those others can come from different systems, different roles, different parts of a village who's supporting a child and family. And you guys are a part of that village. So we really wanted to identify for you as those that are going out and working with programs, ways that we can reinforce that programs or our early childhood professionals are supporting children, right? The first and most biggest key would be adults know how they're feeling. Are they present? Are they calm? Is one of their triggers or their hot buttons being pushed? Are the adults worried or anxious? Because what do we know about that? That feeds directly into that interaction with that child. And one saying is, a dysregulated adult cannot regulate a dysregulated child. So we really, as adults, have to be in tune to what are we bringing to the interaction. We know that nurturing and responsive relationships are the key to helping children develop into the, their ability to express their feelings, regulate their emotions, and engage in interactions. And so I would say that that is one of the most important things that we can do to support children in our early learning programs and families, is to really nurture and see them and develop relationships with them. Another one I want to call out is consistent routines. We know that children find reassurance and safety in routines. It really reinforces attachment with those caregivers. So how do we help programs think about returning to the consistency of those daily routines and adjusting as needed for those new requirements? All of those key pieces, and the key pieces on this slide, are really part of pyramid model practices that we hope programs were doing before, and can really start to think about those same practices with a little bit of a trauma-informed lens, because we're not quite sure what the experiences of the children were when they were kind of in that period of closure and during this time of just the tumultuous landscape that we're in. And the next slide, please. So the other thing is, here's some ideas about ways to support adults. We want to make sure that adults, staff, ourselves have the basic needs that we need, that we have relationships in which to utilize to support ourselves through connection, that we're reassuring and validating staff when they're doing a great job or when they're struggling somewhere, that we create a safe environment in which for them to work and support young children. All of these different things are a key way that early childhood directors and administrators can support adults, but also that we can use in our interactions within our scope of work or our community or our place of employment. So the next slide just asks us, reflect on those ways to support. So those two slides had several boxes with some different strategies that could be utilized to support each other, the programs that we're working with, and also those programs in support of children and families. So what did you notice? Use the chat box to tell us, what did you notice between those two slides? Right, Sarah, many were the same. So there's a lot of overlap in what we can do to support children and what we can do to support adults. You saw the words relationships. You saw the words routines. You saw positive language and reinforcement, reassurance, safety, emotional literacy and coping skills, connection and collaboration. So those are all key things that we all need, no matter where you fall in the lifespan, in order to feel safe and confident and have the skills that we need to participate in our communities. And the next slide. So on the next several slides, we wanted to share some resources that will be helpful in your capacity building role for early learning professionals, but also can be helpful for yourselves as individuals and professionals who are impacted by the landscape that we're currently in. So you'll see we had to put out there, the Octal resources that are readily available to anyone on this call and all of our professionals. We have the Pennsylvania Key website that has links to policy statements, topical webinars, example of cross-system collaborations, and information on infant early childhood mental health. And then the other part of the house around early intervention technical assistance, and Sue Zeiders is on the call and in the chat. They have a whole myriad of resources around social emotional development and professional development modules. I also want to say we have an entire PD registry that's full of different topics for our early learning professionals to access and really build their capacity in those kind of ways in terms of their competencies. On the next slide, we would be remiss if we didn't share, the National Center on Pyramid Model Innovations, which is at that link right there. Most importantly, at the next slide, you'll see that they really created a new resource, the Leadership Team's Guide for Reopening Programs. And it is a in-depth resource that highlights how programs can think about pyramid model practices as they're supporting children, families, and staff. The guidance includes pyramid model practices and encourages you to think about strategies from a trauma-informed perspective. So while your program leadership or team may not know who among children, families, and staff have or are experiencing trauma, this trauma-informed approach guides programs in providing that safe and nurturing environment where children, families, and staff can build that resilience, feel safe, and recover. So I would urge all of you to download this and really start to think about how it might be a useful tool as you're supporting programs in the field during this time. Some of the other, I always like to throw in other NCPMI resources that are kind of some of the favorites of the consultation team that we might use regularly in our supportive programs. Book nooks are kind of easy to use guides around specific books that teachers or families may have in their library at home or in the community library, and just creates ways to embed social emotional skill building in everyday routines. What work briefs are kind of summaries of effective practices around children and challenging behaviors. There's a lot of practical strategies. Scripted social stories are ways to help children understand social interactions and differences in routines. I know that the consultant team created a social story about returning to the classroom and mask wearing and temperature taking, and there's many, many different social stories out there across the nation on this topic. So they're a great way to help families and children prepare for some of those changes. The next slide has other resources that NCPMI is kind of curated. So many of you may know there was a website called CEPL, so the Center for Social Emotional Foundations and Early Learning, and TAXI, so the Technical Assistance Center for Social Emotional Intervention. Those were two different federal grants, and what NCPMI has done is curated and pulled those all into one place where you can kind of search for all of them. So I would urge you to go to that website and look for different kinds of tools for your toolbox as you're interacting with programs and kind of hearing the themes of their concerns or their needs. I also wanted to highlight the National Child Traumatic Stress Network, which is a national organization that is really putting out some amazing resources around trauma-informed care, and specifically they've created an entire page around COVID-19. So, when public health emergencies occur, there's a rapidly evolving, information that's confusing, and it leads to feelings of anxiety. And I know many of us on this call have felt that anxiety. We've seen it kind of come through as a theme across the period of these webinars. But, there are things that we can do to protect and take care of ourselves, our children, and our families and our communities. And knowing important information about how to respond in this landscape is really important. So these resources that NCTSN kind of curated help you think about infectious disease outbreaks or the pandemic and how that impacts your family physically and emotionally, and what you can do to help your family cope in times of public health emergencies. So a lot of great information there on trauma. So just wanted to put in that the ECMH team is available to support programs virtually during this time and on site at a case-by-case basis. Our consultants are working with programs around specific children, as we typically have prior to the pandemic and will continue to do so, but also with programs, professionals, or partners in general who are seeking to understand ways in which they can support their staff, children, and families during this time. So as I said before, the consultants did kind of a statewide audience-specific holding space around those 4 R's. I have a couple consultants that are doing that for smaller pockets in their community. They might be doing it on behalf of an ELRC or a collection of early learning programs. So there's lots of ways that our team is trying to be innovative and responsive to the team. So if you're finding that you have a program or your agency in and of itself is interested, reach out to us and let's problem solve and let's talk about ways in which my team can really kind of be innovative and support the field. I think, Amy, this goes back to you.
Yeah, thanks, Brandy. Boy, that was amazing. I feel like I don't want to end this webinar quite yet.
I feel like I just spoke really fast, so I apologize.
So I remember, Laura, you had suggested that maybe we could ask a couple of questions of the group and get their feedback about what they're seeing maybe and what they're experiencing when they're working with programs right now. Is that something you could facilitate for us?
Yeah, absolutely. Thank you. So we wanted to spend a little bit of time not only having you all ask questions that you've been thinking about number one, supporting yourself and your own social emotional well-being, but questions that you have related to how you can best support the family child care providers and the center-based providers that you are working with. So feel free to use the chat box to ask any questions. But kind of as a prompt, we were hoping that some of you might share some of your recent experiences in working with programs. And are you noticing signs of stress? And how are you addressing that? How are you having conversations with directors or support teams or teachers related to their own internal stress? And what are some of the strategies that you're using in the field that you think are working? So we're hoping that we can use some of our time to have a great conversation within the chat box. And I know there are a lot of you on the phone, but we have found it to be pretty easy to take some people off mute. So as people are chatting in the chat box, I might call on you to share a little bit more with us off of mute. So thank you, Rama, for talking about administrators who are saying things in emails like, I am drowning. I mean, Amy and I had this conversation a couple of weeks ago as we were reflecting on some of your emails and questions that are coming through her email, and how sometimes it feels really desperate or that something really kind of small gets taken to a much bigger height, and how that is very reflective of stress. So thank you for reminding people that we're not drowning. We can pause and take a breath. We can actually take a breath and walk around our building if we have to, and then deal with issues. And so it's really important to help people take things and help put them in perspective. So thank you for sharing that. A lot of worries about fiscal stability and keeping doors open. And I think that is something we're hearing nationwide, is that in addition to taking care of the families, the children, the staff, people are literally thinking about their livelihood and closing their businesses. Michelle was talking about the pressure for doing things right. You know, I want to find out what we can do. we want to do the right thing. So again, that's really important.
You know, this reminds me of, you know, the experience that several of us have had when we've gotten a referral through Connect or even the new survey around programs saying I'm struggling with expulsion suspension practices, or I have a child that I'm not sure what to do with. And oftentimes, just in triaging those calls and speaking with someone, just the idea that someone is holding space for them is listening to and validating their feelings, because feelings aren't wrong, they just are, right? So holding space, listening and validating, and engaging in some reflective questions about what might the next steps be from their perspective, or offering tips. Like I remember helping programs kind of script out what she might say to a family when she really wanted to have kind of a team meeting with their behavioral health provider. How might you have that conversation? What might that sound like? So sometimes we don't have the answers. We may not have the answers, but we do have the capacity to hold space for, validate and listen and be with and see someone struggle. And that in and of itself can be an intervention to help them regulate themselves and think about what they might do.
Thanks for that. I was wondering if we could take Judy, if Judy, you don't mind me picking on you, if we could take you off mute so you can tell us a little bit more about what's going on at the Early Learning Resource Center 5 with your director roundtables. So I'm wondering if we can have you take yourself off mute and just share. Thank you.
I guess we're just noticing, I think a lot of the quality coaches that just in our everyday interactions, we might be having like a grant monitor meeting, or we might be just talking about the STAR standards. And little by little, or one by one, or more and more, we notice these breakdowns. I mean, they're just like unexpected. You know, directors are starting to show tears and cry from the stress. Also just from the stress of the updated standards coming out. And I think, you know, at the director roundtables, they've been able to share their stress, and they've been able to talk about maybe action plans to help, like if they're stressed about, you know, doing their health and safety checks at the beginning of the day, they'll talk about it, and then others will give support and ideas on what they're doing, what works, what doesn't work. So I think, and just knowing that you have other directors there in your, you know, in your county, your region, that are, you know, feeling the same way. But we just hear it more and more at different points. People are kind of falling apart, and several of them have just written emails, just typed emails and just spit it all out in an email. And then they've always apologized, it seems like. And I'm like, wait a minute, you know, there's no reason to apologize. These are your feelings. You know, we can pass these on. We can offer you, you know, these resources. You know, but please, thank you for trusting me with your feelings, and know that, you know, we can start to have more conversations like this during our roundtable. And so Allison Robinson, who runs our roundtables, is going to tie in some of that topic of how to deal with stress, how to manage stress. So those are some of the things that we're just thinking and noticing in our region.
Yeah, thank you for that. And I think it's really important, and I think Brandy mentioned this earlier, that as you have either coworkers or administrators, people that you're interacting with who are demonstrating some pretty high stress levels, and you are able to observe some behaviors that make you think, hey, this person probably needs someone to talk to and someone to really process some things with beyond technical assistance is what I'm talking about. Yep. That these mental health first aid kind of resources are really critical to make sure that you can also pass on resources to say, hey, have you thought about talking to someone about how you're feeling outside of the TA kind of environment? Amy, I really would like to continue on this theme of letting some of the ELRCs share some of the great things they're doing. And somebody asked a question about availability of communities of practice for providers. And so I was hoping that Kim, we could take you off mute to talk about your teacher talks. And then I would love for Lisa to go next to talk about your weekly communities of practice, because again, I think that you all are doing such great things that you can share and learn from. So Kim, can you share a little bit about your teacher talks?
Sure. Back in April, I think it was, we recognized that there were a lot of work groups going on for the directors, and my coworker Teresa Wilson and I felt like maybe the teachers could use a little support because they were really the ones who were on the front line, and they were the ones that were struggling with what to do when we didn't have any guidelines, and they really got thrown into things in March when they had great waivers. So we started out with 3 meetings a week, one in the morning, one in the afternoon, and one in the evening, so that we could hit as many schedules as we possibly could. And we set it up, our premise is that it is a place where they can feel free to share anything they choose to share. We don't ask where they're from. Some will tell us where they're from, but we don't ask who they work for, that sort of thing, because we want to make sure that they're in a safe environment. And it has been working really well. We've learned a lot of, way back in April, we learned a lot of really great tricks that then we were able to pass on to other teachers as they logged on. So it's been fantastic. We do it twice a week now. We do it Tuesday evenings at 6 in the evening, and then Thursdays at 1, again, trying to hit that nap time. And we have repeat customers and we have new customers, and we've had, all types of providers, family groups and centers. And we've built some really nice relationships, as best you can through Zoom. And, it's been nice to have that relationship building. And I think it's just been a fantastic, exercise for both Teresa and I, and for the teachers, because I feel like we're really listening to what they're saying, and we can really, give them ideas, or just say, keep going, that you're doing this, you've got it. So that it's just been a fantastic experience, and we're going to keep doing it for as long as we need to do it. We don't have an end date in sight. So
yeah, Kim, thank you so much. I mean, again, just the power of you all being listeners is so critical. So thank you for that. And thank you for remembering that as we have so much resource going out to administrators and directors, those teachers are in the classrooms doing the very best they can to keep children healthy and safe. And they are also dealing with all the struggles that they have going on at home. So thank you for that. Would love to hear, Lisa, about your communities of practice.
Hi, this is Chris. Lisa asked me to kind of jump on real quick, just to answer a couple, but really what we've been doing is a lot like what they just said, is that we are available for them, obviously, anytime they need through text and emails and phone calls. We get them at, different hours and different modes, whatever is working for the provider. But we do have a weekly session set up as well, so that it is scheduled for the providers so that they can kind of plan for it if they want to, that we set aside a couple hours on every Thursday afternoon, and then at least once a month we offer it also in the evening, so that for the providers who can't get out of ratio, or family providers who just have a crazy nap time or whatever, that they can come on in the evening as well. And we try to have kind of an open agenda where we start off the session every time that so the providers can jump on and off as they need to if they can't stay the whole time. So we have question and answer times where they can come on and just kind of ask questions or vent or whatever they need. And then if they have topics they want to cover, like they've been asking about the new standards, so we've been covering the new standards, that we can go with the topics that they want. If they're not sure, then we try to plan things for them. Like we've been having a attorney come on, and we've had a lawyer come on and meet with them and answer questions, which has had a really big response because they are so unsure about so much. and they have so much on their plates right now. I mean, they have all of the normal things that you have in childcare, which is a million hats to start with, but then they've got the additional concerns of like, how is all of this affecting them liability wise? What do they need to be worried about more? They're so unsure about school age right now, if they're going to be in session or not be in session, who they need to have time for, they are have room for. They also feel the pressure of still all the same things they do. And even though like we are doing, I think they've been very open to the fact that we're meeting with them virtually, and it's been working really well. But also I think it's hard because they also just need that, just like the kids need that face-to-face physical contact. I think their providers need that some too. So sometimes they feel disconnected even when we are meeting virtually. I mean, it helps a lot and they are appreciative. But again, I think we're just missing that in-person connection somewhat, and there's just a lot on their plates. So we've been working with all of that. There has been a lot. There's still, but like someone mentioned in the chat that they were saying about doing a training and then being excited to be outside of COVID for a moment. And we've found the same thing. We've been offering ages and stages and social emotional trainings, and we've been doing different things for them online during a nap time, during an evening. And they've said, thank you so much. And it's so funny because there is so many online options, but they were so appreciative saying, I wish we had more of these. And I'm thinking we send out every week all the things, but it's just, I think it just fit into their schedule, and it's just that connection that it's working. We have several providers that have joined we're doing the pilot program for the learners group, and we've had several providers that are participating in that. And I've just been so proud of them and amazed that with all of the stress and how exhausted they are, and you can see it on their faces, they are still embracing quality and wanting to do the right thing, and they want something outside of that COVID. So they've been, we have some of them that are working on that. We have a closed Facebook group that they go on and express concerns and help each other out, give each other ideas like this worked for us. So they're making that connection with each other. And I think that is the one good thing that's probably coming out of the COVID, is that I think there's such a need for connection that our learning communities and our closed Facebook groups and things like that are giving them the chance to learn to work together even more and reach out to each other even more, that realizing that they're in this together and they understand each other's concerns. So,
Thank you so much for that. I mean, it is, I hope that you all are seeing some of the positive affirmation in the chat box for your work. So please know that, Tracy, you said it so well, that with all the heaviness going on, each and every one of you, and each and every one of the ELRCs and each and every one of the certification regions, I mean, take all of your support systems, you're all doing the best you can do and really putting your arms around teachers and families and providers. And I'm assured each other to work and support each other. So huge thanks for that. Another couple of things that came up in the chat box that I want to recognize. Someone mentioned that they're moving on with their regular professional development, and that going back to routines and normalcy is really, really important. And the person in the comment was saying, and people are really being like, oh my goodness, thank you for not doing a session on COVID. Let's just, focus on something that feels a little bit normalized. So I think that's really important, that getting back to our normal routines is really helpful when we're dealing with stress. So thanks for that. And we have a lot of people, Brandy, who are accessing the mental health consultants, and also who are accessing some of the holding space trace sessions. So again, all these resources are out there. You just need to connect to them and get them out to your audiences. But I also want to go back to something that Anne said in the chat box. Because Anne, I know you are right. It is so important, everything that we're doing around building the relationships and connecting people to supports, and helping people decompress is so important. But people are looking for tangible answers and guidance. And it is so unfortunate that in a world where we really want black and white answers, yes or no, or here's follow this and you're going to get it right. that everything is so gray and everything changes on a daily basis. And so I'm wondering, Brandy, if you have any words of wisdom for when people are craving for just tell me what to do. How do you provide support when you can't actually tell them what to do and you can't even tell them what's going to happen next, today or tomorrow?
You know, what's really funny is my first thought was, I should probably throw that question to Rashida Costin.
Oh,
only because Rashida has the best way of engaging in reflective coaching questions that makes an individual kind of solve their problem themselves. You know, I think one of the biggest things is we have to realize that sometimes we don't have the answers, and there is a little bit of, I guess, a sense of powerlessness that we can't tell the future. We don't know what's happening. All we can do is manage how we're responding today. How are we reacting to our family? How are we reacting to a situation? How are we reacting and or engaging in relationship with others? Sometimes it is just a day at a time, a step at a time, while also really keying into our own emotions with the understanding that how we are impacts how others are. So kind of that knowing, doing, and being aspect of helpers and of community members as family members. We just really, our first step is within ourselves. I don't know, Rashida, are you on? Did you want to jump in at all?
Take it away, Rashida.
Oh, there I am. Okay, at first it said I couldn't unmute myself. Hi. So yeah, what Brandy was saying is so key. Is one is that it does start with us, but I know in the chat someone really talked about how thankful someone was just to allow them to talk for some time. Really understanding, listening to someone, being empathetic, and allowing them that time to sort of talk through what's happening, and really trying to ask them what is at the crux of the challenge for them. Like, what is making it so the need so immediate? When you start to really figure out what is happening, then you may get to the underlying for them, right? Because maybe they're just really fearful to do something wrong. Maybe they're scared to lose certification, but you won't know these things until you really ask them what's really at the crux of what the challenge is for them. Not the day-to-day challenge, but them, how that individual is handling it. So we do talk a lot about the difference between coaching a person and focusing on them versus coaching a problem and focusing on the problem. And in that time when there are no answers, really focusing on the person is one of the best things that we could do.
Thank you so much for adding that. And I want to go back to the chat box and just highlight a couple of things more. Amy, thank you for kind of reminding us a little bit from our psychology courses that this is a little bit like going through the stages of loss and grief. And again, as we think about some of the things that we have lost, it's nice to reflect and think about the things that we have gained. Think about now how all of the providers and teachers that you all are working with in communities of practice who are feeling safe to show real emotions in front of you. Think of how the connections that you are making might not have ever been made without something like this, where you are offering these opportunities to be human together instead of being, I'm a monitor of quality, I'm a monitor of regulations, I'm here to help you with this child's behavior. You had this kind of relationship that was very much about interactions and transactional. And now look at all the people who have surfaced that you've connected with that will now see you in a whole different way as someone who's willing to really support their growth and development and their overall well-being. So thinking about the things that have come up out of this and the connections that you have made because of the situation that we're in. I want to go to a real practical conversation now. someone earlier on the chat box said, hey, let's be thinking about school agers. What are we doing about school agers, and how are we thinking about integrating school agers into early childhood programs? So again, I wanted to see if anyone had any tips to share in the chat box around the integration of school age children, and some of the tips that they're giving around that. So that might be nice to think about as people are chatting into the chat box. So again, Lisa was saying, hey, if you're introducing school agers now because of schools not being in session, really the communication with the parents is really, really key. What are the expectations? What can a program do? What can a program not do? What are the behavioral considerations? What are the considerations around supporting with schoolwork? How much can you actually do? And so that's really important. I was wondering if any of the ELRCs are doing any kind of professional development around integration of school agers for programs who are thinking they need to take school agers in to offset budget. And so if they have some space, they might be doing some school age care. And if anybody's thought about training and professional development. So Lori is suggesting that programs are communicating with their schools. What are the schools offering? Understanding what the elementary schools are doing to support families. What is just basic needs around Wi-Fi connections, computer time, etc. I'm not seeing a lot of chatting in the chat box about possible professional development that could be offered to support programs who are engaging now with some adolescents in their program.
So this is Brandy. I think this is a new mountain or a new challenge that our programs are taking on, is trying to figure out how to do school age programming during the school year, when normally it was before, after school, or during the summer. And so I think one key message that we started this with is that there are routines, practices that we've always used with school age, right, in our before and after school care or during our summer care, that might be really appropriate to continue to create that sense of normalcy, consistency, safety, relationships, while also trying to manage kind of the more particulars around staffing and location and some of those kind of, I don't know, standards or regulations and different things like that. But, in thinking about it, it's still really important to build and nurturing and responsive relationships, to have environments that have routines and consistency. That also makes even older school age kids feel safe, secure, and are more able to engage. See that Shira wrote that Poseidon is doing a webinar on this topic tomorrow at 10 a.m. So, so some of our school age advocacy groups are probably gearing up to create or share resources.
Okay, so Amy, I see that we have the chat box is slowing down a little bit. So I might, if it's okay with you, introduce a little bit about what we're thinking about for tomorrow.
Yeah, that sounds great. Thank you.
I'm trying to, for some reason, my screen is not allowing me to. There it goes. Okay. So just to kind of talk about tomorrow's open space, we're really excited to have Marnie join us tomorrow. to open up our session, but we really want to focus tomorrow on each and every one of you out there helping the helpers. We really want to talk about compassion fatigue. We want to see how you're doing. Where are you on the stress scale? We want to hear how you're taking care of yourself, how you're recognizing stress in your peer groups, and what resources you need to support you. Not resources for the program, more tip sheets, things like that, answers to health and safety questions, but what do you need so that you can be doing the job that you need to be doing, and take a little bit of stress off of your shoulders. So be thinking about that as you join the call tomorrow, because we really do want to focus this on your social emotional well-being. And we're excited that we will have Brandy on. We will also have Susan from EITA. Rashida, we're hoping you'll be on with us as well again, so that we can put the spotlight on you and your needs. So Amy, I'll throw it back to you to talk about reminding people where to email questions and to close us out for today.
Yeah, sure. Thank you so much, Laura. And thank you to Brandy so much for being with us today and really giving us the foundational understanding of what's going on and how important it is to keep our attention on the social, emotional aspects of caregiving and caring for others, and trying to maintain community, a sense of community when people are feeling very isolated right now. That's really important. And hopefully these webinars have kind of provided a space for us, all of us as support people, to have a place to share and to feel like we're a part of a community, because we really are trying to build that feeling, I think, of a team, and that we're all working together, we're walking alongside each other, and we need each other right now. It's really important to stick together, and we can work through a lot of these problems if we have everyone involved. When we feel isolated, we get overwhelmed and think, you know, it's just impossible to deal. But if we stick together, I'm sure we'll find a way through all of it. So thank you again for joining, and we will see you tomorrow at 2. And please email questions and comments to hssco@pakeys.org. I've noted that the questions have slowed down coming into this email, and not that that's necessarily a problem, but I just want to remind you that it's available. And if there's a question that is not related to specifically right to health and safety, or something I can't answer, or folks at the Keys can't answer, PA Key can't answer, I reach out to the people who can. So I welcome your questions and your comments. If there's something that you want to see happen, if you have suggestions for how to make our health and safety support system work better, you know, as we start to leap forward with our working in our regions and so forth, that would be great if we could have that communication as we go forward. So thank you again, everyone, and we'll see you tomorrow at 2. Thanks. Bye-bye.